Hi everyone. In this video we are going to learn about the IM injection. It is a part of medication administration. I am Jenlyn Bernard, working as tutor in MMM College of Nursing. This video will be helpful to understand and gain knowledge about IM injection, different sites of IM injection, procedure, general instructions and the complications related with IM injection. Intramuscular injection. Administering medication into the muscle mass by using a sterile needle and syringe. The purpose of administering intramuscular injection is it is useful in administering small amount of medication, rapid onset of drug action which helps in emergency. It is useful when the patient is unable to tolerate oral medications. The related general instructions are: check for history of any drug allergy, follow the strict aseptic technique, observe 10 rites of medication administration, select the appropriate size of syringe and needle, choose the correct site for injection, change the needle after loading the medication, and ensure adequate privacy for the patient. The common sites for IM injection is deltoid region, ventrogluteal site and vastus lateralis. The deltoid site is very easy to access. Also, it is having the potential risk for nerve and blood vessel injury. In this site, only a small amount of medication can be administered. Ventrogluteal site. It involves the gluteus medius and it is away from the major blood vessels and nerves. It is the preferred site for IM injection for infants to adults. It is suitable for larger volume of medication and more viscous and irritating medications also. When we are comparing with the other sites for intramuscular injection, the ventrogluteal site is having less complications. Vastus lateralis site. It is suitable for adult and children, commonly used in infants, toddlers and children. The site is suitable to administer immunoglobulins, vaccines and toxoids. Dorsogluteal site is not in practice nowadays. The reason is it is having the high risk for making nerve injury at the sciatic nerve. When we need to administer the IM injection, first check the doctor's order in the medication administration record and collect all the needed articles. The prescribed medication. When you are taking the medicine, remember to follow the 10 rites of medication administration, appropriate size of syringe and needle, alcohol swab, puncture-proof container, injection tray, gloves and a kidney dish. Remember to check the name of the medication 3 times and ensure all the 10 rites are followed. Wash hands and load the medicine into the syringe by following the sterile technique. Identify the right patient. Explain the purpose of injection and the action and side effects of medication to the patient. Provide adequate privacy. Perform hand hygiene. Identify the appropriate site and expose only the needed area. Also ensure the patient is positioned comfortably. Clean the injection site with the alcohol swab and support the skin around the injection site with a non-dominant hand. Remove the needle cap and insert the needle in 90 degree. Do it slowly and gently. Once the needle is inserted, aspirate and check whether there is any backflow of blood is present. If the backflow of blood is there, the injection should not be performed. If not, gently, slowly inject the medicine. Once the entire medicine has been injected, gently withdraw the needle and syringe in the same 90 degree. Cover the injection site with the sterile alcohol swab. Ensure the patient is comfortable. Position the patient in the comfortable manner. Perform hand hygiene. Document the procedure in the medication record as well as in the nurse's record. Z-track IM injection. It is used to prevent medication leakage, particularly for oily injections. It can cause less discomfort to the patient. In this technique, there is decreased occurrence of lesions at the injection site. When we are administering medication in the Z-track technique, slightly retract the skin and perform the injection. Once the medication was completely injected and the needle was withdrawn, leave the skin. When we are leaving, the way the needle was inserted will be forming the Z-like pathway so that the medicine will be sealed and it cannot be leaked outside. The complications related to IM injection is it may cause severe pain, fibrosis, tissue necrosis, muscle contraction, gangrene, infection, abscess formation, nerve injury and paralysis, vascular injury that may lead to prolonged bleeding. The nurse's responsibility when administering IM injection is follow 10 rights of medication administration, use appropriate technique, maintain the sterile technique throughout the procedure. The knowledge about anatomy is highly required to prevent the nerve and vascular injuries and ensure the medication is administered safely to the patient. In this video, we have learned about the definition of IM injection, different sites for IM injection, procedure, and the related complications of intramuscular injection. It is the responsibility of the nurse to administer the medication safely. For this, I have referred the nursing foundation textbooks and also from the internet. Thank you for listening.